Hi everyone, welcome to Skywriter MD. Today I'm going to show you how to use the hybrid asynchronous model of the application. First and foremost, we're going to log into the app. Every doctor will have their own set of credentials and you can access the app on any device that you currently have, whether that's your iPhone, iPad, or laptop. So I'm going to sign in with my credentials. As you can see, this is the user dashboard. I am walking in to go see my first patient, my 9 a.m. patient, and I'm going to start a dictation. So I can either record in the room with the patient or outside the room, but today I'm just going to record in the room. Seeing my test patient, 9 a.m., and I'm going to click next, and I'm going to start recording. So hi, test patient. Looks like you are coming in for nausea and abdominal pain, correct? And these symptoms started 2 days ago. You described the pain as sharp and on the left side, correct? And you have no associated symptoms, including a headache, correct? Now I'm going to give you the physical exam and examine your belly. Test patient, looks like you do have tenderness to palpation on your left lower quadrant, but everything else looks good. So for your nausea, I am going to prescribe you 4 milligrams of Zofran to take when needed. This is a disintegrating pill that you will put under your tongue and you'll wait for it to dissolve. I'm also going to start you with 20 pills, no refills for now. For the left-sided abdominal pain, I will order you an abdominal ultrasound. If anything worsens or additional symptoms develop, please give me a call back into the office. So I'm also going to send a red recording to make sure that those orders will get done quickly. So I'll need Zofran 4 milligrams, 20 pills, no refills, sent to their current pharmacy, as well as an ultrasound, abdominal ultrasound. And that should be it. So I submitted that recording. Those are the orders that I need to have done right away before the patient leaves the office. So you click submit, and that's already going to be sent into the queue for the Skywriters to listen to and enter it into your chart. And now I'm going to complete the chart. So I also want to add in level of service. Let's build this patient and establish level 4 or 99213. I want to see them back in 6 weeks. I'm also going to send a referral to GI. Once that is complete, I can say my highs and lows or I can say my goodbyes, not my highs and lows to the patient. Click submit and move on to go see my next patient. Both recordings are going to be submitted in the queue. So I have a red team recording as well as a dictation. One Skywriter on my team will listen to this recording and enter it directly into the EMR. And I'm going to show you what that looks like right now.
Hi everyone. So as a Skywriter, I know from my workflow that I need to go ahead and pre-chart for TIS patient. I do so by navigating to the Note tab. It's understood that I'm to use the Sky Note unless otherwise notated. I also go ahead and apply my review of system macros and my physical exam macros, and then I'll edit based on the recording. I've done that, and I do see that I have a red team recording for items that I need to take care of immediately. So the first one is going to be prescribing Zofran 4 milligrams. I'll apply that and go ahead and pin. From here, I can insert the quantity that was dictated to me as well as the 0 refills. I'll click accept. There are some items that I was not aware of, but it is only a pinned order, so the doctor can still go back in and edit that order for me for the rest of the information. I also want to get an abdominal ultrasound from the red team recording. So I will go ahead and pin that. Once I have that done, I can navigate to my next recording for the actual note. So it was notated that this patient was being seen today for nausea and left-sided abdominal pain. So I can go ahead and add that into the note. It was dictated that the nausea had an onset of with sharp abdominal pain. With an onset of 2 days ago. And there are no associated symptoms and no headache. From that, I'll navigate back to my review of systems to input that they do have nausea and they do have abdominal pain. I'll also go to the physical exam. It was dictated that there was tenderness upon abdominal palpation. I will enter that. It was also dictated to me that I needed to add a new diagnosis of nausea as well as left-sided abdominal pain. I will add those, and then I will also add them to the problem list. And from here, I can enter my assessment and plan. For nausea, we want to start Zofran 4 milligrams, quantity of 20, and no refills. Same for the left-sided abdominal pain. I can add that I want to order, or I did order an abdominal ultrasound. I will accept that. If I navigate back to the note, I can refresh, and these are added to my problem list at the bottom of nausea and left-sided abdominal pain. For this, it was a level service of E3, the 99213 code. I will assign that. And then I will navigate to the wrap-up tab to enter the follow-up, any other items that I need to do. Maybe it was a referral to the PCP. I can add that in as well. Same with the follow-up, I can indicate that here. And then if I were to need to do any other chart review items like marking histories or allergies as reviewed, I can do so here as well as enter discrete data entry for any past medical history concerns.